The veins, like arteries, also suffer from diseases, and the commonest diseases affecting the veins are, again, they can either get blocked. If they get blocked, that can because of a clot developing, that is called deep vein thrombosis. These clots can actually cause local problems by way of swelling. The whole leg gets swollen, the whole arm gets swollen, and this can sometimes be excruciatingly painful. Or a clot can actually break off from the leg and travel all the way through the internal system and go and lodge itself or get stuck into or block off a main artery inside the lung. And when that happens, a person can sometimes even lose his life. That's a pulmonary embolism or a clot in the lungs. So veins with clots in the legs is an extremely dangerous, almost fatal condition at times. The second condition which affects the veins is a dilatation of the veins. That means the veins also become much larger and they keep becoming bigger and bigger, and this mainly and usually affects the legs. And this is primarily because of our habit of standing. Because we are a two-legged animal, which means that we are standing and the gravity is affecting our blood vessels. All the blood is actually stagnating and pooling around the ankles, which can, in certain conditions, give rise to what are called varicose veins. There are various grades of varicose veins. They can be small, medium or large. The small ones, the extremely fine ones, are called spider veins, or very, very thin, fine, green, blue veins which are just under the skin, just obvious, causing no symptoms apart from just a cosmetic disfigurement. That means you can actually see them, but you can't even feel them. And these are primarily cosmetic and they may or may not require any treatment. But once they become bigger and they start popping out of the skin, which means that you can actually feel them, these can sometimes require treatment. And if they are large and they start almost hanging out of the skin, these are large varicose veins and they definitely need treatment. Sometimes laser treatment, radiofrequency ablation or mechanical-chemical ablation treatments can be required for treatment of these varicose veins. The third most important venous or vein complication of disease is that affecting the development of these veins at birth. So at birth, if suppose a trigger sets off a complete multiplication of these veins, and these veins start multiplying at a rapid, furious rate, and you have millions and millions and trillions of veins developing in an area which should probably have maybe 3 or 5 veins, and that gives rise to a venous tumor or a venous malformation. This definitely has to be treated, because if it ruptures, there can be serious hemorrhage and bleeding, and which may require emergency surgeries. Sometimes people can even lose their lives if the bleeding is excessive. So these are the 3 most important venous diseases which can affect the vascular system.